Aloha, everybody. Welcome to Maui Source TV on the Road. I'm Eric T. Richter, your host, and I'm with Debbie Powers today, who's a licensed marriage, child, and family counselor in Orange County, California. She's also a certified addiction specialist. So she's going to give us some fascinating information on the update on addictions. And she just attended a week-long conference last week on the advanced methods of psychotherapy being offered now across the United States. So welcome to the show, Debbie.
Well, thank you very much, and I really appreciate you having me on your show. It's really a pleasure.
No worries. We've known each other since 1985, so we're very comfortable interviewing each other. So enjoy the show with us. We're going to have fun with this, even though it's about a serious topic, which is addictions. So why do people become addicts, in your opinion?
Well, we really don't use the word addicts anymore. It's more of an addiction to the thought rather than it is the substance. And the substance can be anything. It can be food, shopping, sex, drugs, alcohol. It manifests in many forms. So right now we're more concentrated on the addiction to the thought. That's the core level.
So you're talking about the repetitive behavior of drinking alcohol and getting into the stupor, etc. It's a repetitive behavior pattern that you're trying to break,
right?
Versus an actual addiction to a substance, which is what I thought it was.
Well, it does turn into a physical addiction to the substance, but if we can get to the core of the thought process, then we can actually see some headway.
And I understand you come from a Buddhist perspective and a mindfulness perspective. What does that exactly mean in dealing with these thoughts? Because you're a holistic therapist as well,
right? And this is their philosophy: is the mindfulness is actually the addiction of the thought.
Okay.
So it's not really, Of course, we have to treat the physical addiction, which is a manifestation of the addiction of the thought.
So it's addictive behavior that you're treating.
Addictive thought.
Okay, thanks for the correction. I'm not quite getting it yet, but I'm hoping that I will.
I know it's
a whole different concept to me because I watched my mom and my dad, who are both alcoholics, go through cold turkey withdrawal, and all they basically had back in 1970 was the AA program and the sponsorship, etc., which worked for them because they stayed sober, but at the same time it was an excruciating process to come off of alcohol and to watch my mom get really writhing in the bed and just basically in a very painful state. So what is it now? Because I know there's some advanced drugs and things. And so before somebody comes to you, say somebody's an alcoholic that's watching this and really wants to quit, what would be the first thing that if they came to you, that you would do for them?
Okay. Well, let me give you a little history first.
Okay.
I recently referred a patient to Alcoholics Anonymous, and the gentleman that I was talking to, he had 45 years of sobriety. I was referring this patient to him, and he was telling me, "No, Debbie, it's a choice, it's just simply a choice." And I go, "I'm not sure it's really a choice right now." The research that's coming out, I come from a medical model, and the medical model actually does say that there are some genetic components to this disorder. So if you do a family tree, which I've done recently, because you can look through your family tree and look at all the alcoholics. You might have grandmothers, grandfathers, brothers, sisters. It does look like it is a genetic, but there is evidence to suggest it is a genetic disorder.
Okay.
So because of that, I do work in the medical model. The first thing I do is I will refer the patient to an addictionologist. We actually have MDs that have specialization in addiction. And we only have probably 5 or 6 in Orange County in California, and I'm sure Hawaii has addictionologists as well.
Well, I don't know whether we do or not because I've never heard the word before, but an addictionologist is a medical doctor, and from my understanding from our little practice video, they will prescribe a cocktail of substances that you take with the withdrawal process that makes it easy.
Right.
which is like, okay, this is something new to me. Of course, my understanding is that I know nothing about it, and it's 47 years old.
Right.
Where I'm coming from, it was when
Mm.
they became sober when I was 15, so all I knew, I didn't know it had advanced so much. So what's actually in this cocktail that the doctor will prescribe?
Well, if you're coming off of alcohol or any opiates, I do highly suggest that you go to a doctor, your family physician, if you don't have an addictionologist. And if you do need a medical detox, they will admit you to the hospital. On alcohol, it's usually like 3 days that the insurance will pay for. And on opiates, it's about 10 days. But I'm not sure that they're paying for opiates right now. So that's kind of a tricky. The reason for that is right now they've come out with some medications. One is naltrexone for alcoholics or alcohol withdrawal. And actually what the naltrexone does is stop that thought process from occurring. So you actually do not have any cravings while you're on the naltrexone. So people actually are telling me, I haven't thought about having a drink ever since I started taking the naltrexone, which is a wonderful drug.
Are you doped up at the same time? Does it have alcohol-like effects?
I haven't
You're perfectly conscious?
I haven't heard any side effects.
That's really
one of
wild.
my patients did have side effects, and then on an opiate, what they have is they do have some medication, Suboxone.
So it's not methadone anymore.
No, but they do give Suboxone temporarily while you're detoxing from the opiates. And then there is some newer stuff out. Vivitrol is a shot that's given, and it does last 1 month. And
Wow.
it does have the naltrexone in it. So, there's all kinds of sources. You'd have to talk to your physician about this. I'm not an expert on medications.
So people that are addicted to painkillers, do you deal with them at all as part of your practice?
Definitely.
Okay, wow.
But definitely go to your physician and get an evaluation before you start this process. Make sure that there aren't other health issues going on.
So then they would come to you and you're a counselor, or in Hawaii, if she does a telemedicine session with you, it'd be considered a coaching session. So it'd be cash only from Hawaii, but for somebody in Orange County who's got a different kind of, what types of insurance do you accept?
I'm on all the panels.
Okay. We're just going to let that go and keep on with our interview.
Yeah, sorry
we have a computer that we're filming on, so we're in an informal thing. I'm in a t-shirt. We're just relaxed today, so as Terry Cole Whitaker used to say, just kick off your shoes and just relax with us here.
Right.
We'll try to ignore the interruptions.
But there is a lot of hope. There's so much hope in
I know,
this
it's so much
right now.
so much easier. I almost want to be an addict and have to go through this process. Do you do spa treatments too?
Actually, I do recommend them.
Massage.
But
let me massages. Okay, let's back up.
Let me go
talk.
through. Oh, okay.
We'll go through the process. So an addict comes, you're doing your intake with them.
Okay.
So you have a form that you fill out, obviously, as a new patient form.
I do take credit cards if you're going to call
credit
me on the
cards.
phone.
We won't talk about the credit cards too much right now because that's another issue. But go ahead. We're having too much fun. It's okay. You're an addict. We're not going
to be addicted to credit cards too.
We don't judge you. You come from an atmosphere of non-judgment about
That's
your
why
addiction.
we don't use the word addict.
The addict is old. Shut up, Eric. Okay, tell us what you call them now. Are they a patient?
Beautiful human beings.
Okay, that just fell off something. I don't know what. Fell off a wagon?
Well, I think everyone's addicted to something.
Well, yeah, oxygen and water for one.
You could be addicted to the news.
That's true. You're right. I'm not a news addict. I turn it off. I look at the headlines and say, screw it. There's too much positive things to do. The phone. Yep, texting.
Or your computer.
All that stuff. Yeah, okay. All right, so let's get back to some hardcore alcoholic. Do we still call them alcoholics?
They do in AA.
What do you call them?
Beautiful human beings.
Oh, come on, Debbie. Well, they're your clients, right? So you're not going to judge these people when they're coming through the door because you've had alcohol issues. I'm an adult child of alcoholics.
Mm-hmm.
I'm addicted to high-frequency spiritual energies. I admit it. It's like I'd rather be, meditating in a cave than dealing with some people that I've had to deal with in my life. Is that avoiding people? I don't know. Here we go. we'll get back to the video, right? Enough about me. What about you, Debbie?
Okay, so
and your practice. We really are serious. She really is.
I do want to work with you.
She is. She does have a thriving practice here in Orange
Yes,
County,
I'm very
and
well
she
known.
does have an office. And she's a real person. She is licensed alcohol and drug counselor and etc. Okay. Back to you. So what happens?
One time we were on a cruise and we started laughing so much in the seminar they had to ask us to leave. So
I know.
We're trying to contain ourselves here.
Exactly. We're soul brother and sister here. So thanks for joining out with us and putting up with us through this momentary relapse into our comedic lives.
Okay, so this is this very serious subject.
You got white dots on your face. Try to not do the white dots. That was a good one, though. Okay, keep going. We're going to put this up. We're putting this up unedited. It's just going to go up the way it is because we don't have time to redo it.
Okay, so after the doctor clears you, then you'll start working with me. And we work 1 hour a week, and I like to have the same time every week, if possible. After 30 days... I will be working with your doctor as well. After 30 days, I would like to see your family members, so you can bring them in individually or as a group, and but not before the 30 days because I don't want anything to trigger you to relapse. And then you'll probably be working with me for at least a year. Weekly sessions or every other week, or some patients go down to once a month. It just depends how well you're doing. And there's many things that you can do on your side. Of course, Alcoholics Anonymous is a wonderful program. I love it. And there's Smart Recovery, which is another wonderful program. There's many churches have programs that you can get involved in. I do suggest that you go see a nutritionist. Very important. Your nutrition is extremely important. Exercise, CrossFit or Pilates, yoga class, anything that will help you relieve some of the stress, because as we know, stress is a big trigger for a lot of these addictions. And we're all living in a society right now with high levels of stress and anxiety, and this is our biggest thing. And of course, I want you to start a meditation practice. It's extremely important.
And it's easy too because you got a mindfulness app that you've downloaded that's only 10 minutes a day. So everybody's got 10 minutes.
10 minutes a day.
It's like we're supposed to do our actualism sessions that I learned for 45 minutes. Well, that doesn't happen. It's just not realistic in our fast-paced world now. We even talk so much faster than we did in the 1960s. And I want to remind everybody that's addicted to the news that remember back in the 60s, it was Walter Cronkite for 1 hour a night. We didn't have 24-hour bombardment with the news. Mm-hmm. So, there's a lot of stressors that are being aimed at you, trying to get you hooked into all this crap that they want you to be upset about. Mm-hmm. And everybody's got post-traumatic stress disorder.
Oh, that's so true.
It's like ridiculous what's going on.
Oh my gosh.
So turn all that crap off.
Right.
Go out in the park and have a picnic. Go to the beach. Go get your favorite book. Go relax and listen to music. Just turn the TV set off. Don't watch anything that's too polarized, that's either too far left or too far right. So forget Fox. Forget CNN for the most part. Read the New York Times. That's the real news. Even though they say it's a fake news, it's not. It's the real news.
Well, why don't we just try a little...
I divested a little bit in that.
Let's just try a little therapy session right now so you can kind of get a taste.
I'm the adult child of alcoholics, and I'm showing up at Debbie's office. Nice to meet you.
Nice to meet you. Thank you for coming in.
Thank you. I know that I'm an adult child of alcoholics. I just found out that... some things about it at the age of 61. I'm a perfectionist. I'm a workaholic. I have loyalty beyond reason. And I'm a people pleaser. So I think I've taken some steps in my life to realize these things and to put healthy boundaries between me and some family members that basically got me on the loyalty one, and etc. So, I've done some really good things. And basically, if anybody's toxic or critical to me for no reason, I'm sorry, but I have 100% cutoff rate on you on your initial abuse. So, except for my husband, of course, he's very loving, but he does get into it every once in a while.
Now, isn't that beautiful how transparent he is? Tom is very transparent, or Eric, as he goes by. And
my legal name is Tom. You'll find that out next year.
But very open and honest. And that is the first step to recovery, is being completely open and honest with yourself and others.
Mm-hmm.
Because we're so used to, in our disease, hiding.
Right, hiding behind the shame, I guess.
And hiding our alcohol, hiding our alcoholism, on and on. So I think that's wonderful that look how transparent you are in front of the camera. I mean...
Well, I'm fine with it. If other people have issues, then, if you contact me and you're mean, well, I'm sorry. I'll just say, I'm sorry you can't be in my life, so goodbye.
So that's a very good first step, is to admit that you have a problem.
Okay.
And you've admitted that you are an adult child of an alcoholic. And in fact, he even took a step and went to a meeting of adult children of alcoholics.
Well, no, I didn't, because I went to a psychologist, and after 2 sessions with the psychologist, he kicked me out because I didn't have any issues. I was too high functioning. I was too happy.
Even
but
though
I found
you're
out
high
the information
functioning,
about it.
you can always have a therapist. And
That's
it's
true.
always good. Therapy is really for people who want to learn more about themselves, become a better person.
Right.
Always growing. I mean, we always have to keep growing in our life.
Right.
And setting healthy boundaries. That's what Tom's talking about, is setting really healthy boundaries with the people in his life. He doesn't allow any toxic people in his life. And when you are in recovery, you don't want to have any triggers. And sometimes toxic people will give you a trigger.
Well, people get upset when you change.
Yeah.
And to your old addict friends, the people that are your drinking buddies or whatever, you may have to let them go. And they may not be happy about that because they're used to having you in their lives. And
right.
It's just like you have to say, well, sorry, I'm not into that lifestyle anymore. And, if you're drinking, I can't be your friend anymore.
Right.
And that's a healthy step in the right direction, and find some sober people that you like being around and you have fun with. And, you can create a new community. And even with your family, if there's toxic people in your family, just say, sorry, you're toxic. I'm cutting you off. You're not on my Facebook. You're never, ever going to be back on my Facebook. And go find your real family. Like, Debbie, she's my sister, she is. And I'm her brother. We've loved each other forever through the ups and downs and financial craziness and the Church of Infinite Credit and the other things that we've created for fun to amuse ourselves in the metaphysical world way back when.
Our credit
cards, yeah.
We're cured of it, though.
We are, even though we're not ready to go buy that $800 pair of sunglasses. We've realized
charge.
We'd have to go on our credit cards, and no. We'll just...
I often get this question. I have a lot of anxiety, and I take Xanax. This is what I hear frequently.
Okay, what
does
Xanax do?
Just to let you know, Xanax does induce anxiety. That's why the drug is such a popular drug. They keep you really addicted. And so
why does it induce anxiety? I thought it was supposed to reduce it.
Exactly. But what happens
when you go off of it is...
Right,
okay.
you go lower. It helps the anxiety when you're first on it, but then when you get off, it wears off, you really get anxious, and so you need more and more and more. And we've detoxed a lot of people off of Xanax. So I'm just going to really suggest that you work with your physician on this topic, because on this issue, because... once you get sober and get all the substances out of your system, you're going to feel wonderful.
Right.
You won't have the anxiety. If you're doing the meditation, you're doing your exercise, your yoga, you're eating right, your nutrition is extremely important. And you're going to feel a lot better.
Well, good. You talked about telemedicine a little bit. How does that work? And you talked about an app that you can do for the breathalyzer.
Yeah, and for right now there is, and I don't need to promote this company, but there is a company that has a cell phone that randomly will notify you to breathalyze, and when you do breathalyze, that takes a picture of you. And so this is very effective. I've had a lot of people stay sober this way, and a lot of wives are extremely disappointed when they find out their husbands have been drinking, without them knowing about it. They feel betrayed. So this is a really nice tool for the wives. They can actually get a report daily. I'm actually on one of my patients' notification right now. I'm getting his reports every day, and it tells me, what he's doing, how, if he's breathalyzing with alcohol or not.
And you also mentioned the app for the mindfulness or the meditation. If somebody would like to download it, is it a free app that you can get? Or
well, I've tried all the apps there are, and when you do call me, I'll give you some suggestions. But there is one that I particularly like. It does have a yearly fee, but it's very minimal. It's a few dollars a day.
We did it yesterday. It was really cool.
Yeah, it's very nice. It's a guided meditation. Every day it reminds you, and it has a different meditation.
It's a little teaching thing. Like yesterday it was on emotional well-being or something, or I forget what it was, but it was a real cool little reminder that, realistically, you're the only one that controls your thoughts and how you react to everything in your life. So, you can choose to come back at people with their level of anger, or you can step back for a minute and think about it and come back from a loving perspective and, get away from those people. It's like, bye-bye.
Well, the most important thing in being sober is not reacting. This is what I teach in my practice. And this is why it's very important to meditate, because in meditation it will teach you to observe your feelings. Why is this person making me feel angry inside? Let me really look at that. Oh, it's triggering something from my past. And then you can bring this to the therapy session. We can start working on these triggers. But the whole goal of sobriety is not reacting.
Okay.
And that's very difficult. It's going to be the hardest thing that you can do, because when you walk in a grocery store, for example, you see all these beautiful bottles of wine that have just been out. I don't even walk in the alcohol section of the grocery store anymore, because I don't want to be triggered.
Right.
But that is a trigger, or if somebody cuts you off while you're driving, how are you going to react to that?
Right.
So these are the tools that we learn, because when you do get angry, you get out of control, that's when you want to have a drink or use your drug or go shopping or whatever your addiction is.
So that's great. So you help people identify what their triggers are.
Right.
So when that behavior pattern comes up, then you're aware of it and you can stop reacting.
Right.
And start and either hold it in or go home and beat your pillow or whatever, but you're not there in the present moment doing it, and you're not grabbing your bottle of alcohol to assuage your anger.
Now, I ask this from my patients. They go, well, I've been taught to express my feelings, Debbie.
Right.
So if I'm not going to react, how will they know what I'm feeling? So I ask you that. How would you respond to that?
Well, I've been working on being non-judgmental, and I got a special dispensation from God that it can apply to all situations except while you're driving. So I would encourage you, while you're driving, to get your anger out at those idiots that are on the road that are doing really stupid things that you can't figure out what the hell they're doing. And also you can just spend the time on the road, since you have this time that you're in the car by yourself, to call people fucking assholes or anything else you want to do about the people that are in your life that are really fucked up. And then just spend that time in the car, but try not to express it to them personally while you're have to deal with them. If you're stuck in a situation with a boss or a child or somebody that's in your life that you can't get rid of them or just cut them off completely, that you don't react and just don't talk to them anymore. Just have a minimal interaction. But that's how I would deal with it.
It is a challenge.
You probably would not agree with that.
It is a challenge, but hopefully, you can get to a point like going to family reunions, like Christmas is coming up. There's a lot of people that are going to trigger you.
Right, they'll try to.
So if you can practice before you walk in the room, so you can be around these perpetrators.
Right.
Without reacting, and go into it with a loving, kind, compassionate
And that's what I do with my actualism practice too, is because we set our field every day and do our meditation. And you can set up things in advance where your field, wherever you're going, is already cleared. So that I do that at work all the time too, because I work as a waiter at a resort on Maui, and I just set it up so that the field is clear. So other people that are waiters are having this horrible experience with their clients, and everything goes smoothly with me, and I'm doing really well, and people tip well, and you always get the the assholes, but you can not react to it if you get stiffed or get a low tip, and you don't have to be cursing them or thinking negative thoughts. So good stuff.
A lot of people are hurting in the world right now.
And the stress. What do we do with the stress about the world? And we could be bombed by North Korea, and then there's Trump.
A lot of people have a lot of anxiety right now. So it's really important that we all take care of our energy field and protect ourselves from this negative force. And you can be happy. You can be hopeful. There's so many wonderful things in life.
There's so many positive things happening. Focus on the positive.
And being sober is the most
negative.
Wonderful gift in the world.
It is.
It opens up your eyes to the world. You're aware of everything. You feel good every day.
Well, plus your spiritual practice, you have a clear connection with God.
Right. And that's the bottom line.
That's the biggest part of the whole thing, is that if you can get that good vibe going, then you've got that constant download of positive energy into your life.
Right. Because we want to be the white light in the world.
The white light?
Yes, the many white lights.
I gave up being a world healer. I figured other people could do that, and some people do. They're the
we all have
healers.
to make a difference. All we have to do is one little thing, and it'll make a difference in the world.
That's true. You're right. One person can make a difference.
Tom said yesterday that when he was talking to me, he actually saw a white light around my heart area.
Yeah.
Isn't that a beautiful thing?
Yep, and the angels were around yesterday too. That was a lot of fun. So anyway, I want to thank you, Debbie, for being on the show. I think we covered a lot of territory.
Thank you so much for inviting me.
And we're not insane. We're too sane. And that might be triggering you. So if you'd like to get in touch with Debbie,
949-249-8888.
And it'll also be in the comments below on Maui Source TV YouTube. So thanks again for joining us.
Meet you.
Merry Christmas, Happy New Year, Happy Valentine's Day, Happy 4th of July, and Happy Thanksgiving. Namaste. Aloha.
Peace be with you.
Oh, it went off by itself. Isn't that weird?
Mm-hmm. Don't touch that. It's still recording.
We're still recording, folks. We don't know that the camera's on, but namaste again. Because we're not going to edit this, because I can't. It won't let us in. Let's just unplug it. There it goes.